Hi, so today we're doing 4.25, health and safety in health and social care in the workplace. The aim is to understand how health and safety legislation is implemented in health and social care within the workplace. I just want to let you know that this session is being recorded, so you're aware. So actually you can go back and look at this content. The first one is 1.1, which is the first learning outcome. It's to review systems, policies and procedures for communicating information on health and safety in health and social care workplace in accordance with legislative requirements. So the reason why we have legislation is to reduce risk. Some of the potential risks in your workplace may be hazards of risks. So therefore, you put the legislation in place to reduce the risks, and also the responsibility and liability as well, because if there's an accident in the workplace, then obviously somebody's going to be reliable for that accident if legislation has not been followed. It's for prevention measures. So if you linked it to an act, you could potentially link it to the Children Act 2004, because that states that it's everybody's responsibility to look after a child from significant harm. So that would be how you implement that legislation within practice. So the Act gives a legal framework to the legislation. It's there to reduce the risk and hold somebody accountable if the risk is identified. So as an employer, you must adhere to legislation to ensure best practice. These are some suggested legislations. These are all on the slides, which I'll actually try and put up for you 1 minute. If you go on to 1.1, it says Health and Safety at Work Act. There's health and safety, there's management, health and safety regulations, reporting injuries, disease, dangerous occurrences regulations. So you can review and show how legislation is upheld in your practice. You must first decide what legislation is in your workplace and what legislation you want to talk about to ensure that you're addressing that learning outcome. More legislation goes on. There's the electricity at work regulations, food safety, so that'll be like your food hygiene, and there's many more. I mean, you can pick which ones you would like to talk about out of these. These is just a suggested list. And then it goes on to Health and Social Care Act 2008, Care Standards Act 2000, the Mental Health Act, the Disability and Equality Act, the Children Act, and the Child Care Act. So an example of actually implementing and using these acts within your writing to show that you've understood, an example might be to say the Disability and the Equality Act 2010 is upheld in practice, as in your workplace. It's a workplace that's accessible for everybody, regardless of any disabilities, such as a person that's in a wheelchair. Therefore, it upholds the Disability and the Equality Act 2010 because it ensures equality for everybody, and it promotes the same rights and opportunities as it should do for everyone. An act should be very inclusive and specific to a certain person. Another example of this would be how your workplace upholds, maybe it's the Children Act 2004 in terms of health, education and development, the safety needs of the child, because it's everybody's paramount concern that a child should be safeguarded. You go on to say that the legislation is to aim to protect children and put the responsibility on all practitioners to safeguard children. So you need to take an act and put how you uphold this act in practice. How the legislation is actually implemented. So it's not good enough to just talk about an act. You've got to show me what you know and how you've understood the act, how the act is implemented within the work practice. And then if you go on to 1.2, which is the responsibilities, health and social care workplace for management of health and safety in relation to organisation structures. So this is how the organisation implements these policies in a system, in procedures, in their structures. So the responsibility of the business, the manager, is to comply with legislation, because it should always come from the top and work down. It's up to uphold the legislation within practice. You must keep records. For example, you might keep records of an accident that's happened in the workplace. You might keep record keeping if you have a signing in book for visitors. That's also promoting if anything happened at a certain time, like if there was an incident and then they look in the logbook and find out, well, you know, the person signed out, so you wouldn't be liable for that. Keeping systems up to date, see what's working and not working. For example, if confidentiality is a factor within the workplace and it's on a piece of paper and somebody's got hold of that piece of paper, maybe it's best practice to put anything confidential within the computer. Then again, arguably, it might not be, because there might be the staff teams all accessible to that information. But then again, if it's a safeguarding concern, maybe they all need to know. So it's taking the acts and scrutinising the acts and saying what might be best and the reason why them systems and procedures are put in place. And it should all come down to best practice, to safeguarding the staff, to safeguarding the service users and the business. Also, like I said, you can link confidentiality into there. And then if we go on to 1.3, which I've put down as the responsibilities, you need to analyse, to say what's important to the above. Why? So when you're analysing, you need to put like the strengths and the weaknesses of a certain aspects that you're actually talking about. So like, who has the responsibilities? Because as a manager, you don't want to put all the responsibility on you. You should be working within a team. So you give other people accountability for certain things. Obviously, if it's in their job description and they're confident enough to do that, because it's up to a manager to make the practitioners aware of the policies and procedures, because it holds people accountable. As a manager, if you're not telling people the policies within work practice, then you're going to be the one that's accountable for it. So if you promote CDP, like putting your practitioners on training programs, it's obviously going to be beneficial for the company and also beneficial for their development within practice. And on the other hand, if as an employee you're not comfortable with something that works within practice, you can voice your opinions and you can turn around and say, no, you know, you don't think that you're following the policy right. Because at the end of the day, if you do something wrong, then you'll be accountable for something that's potentially gone wrong. So not only do you have to protect your employees, you're protecting yourself. So it's good to have a vast knowledge on legislation and policies within the workplace practice. I'm sorry that obviously you couldn't make the session and you couldn't attend it today, but if you do have any questions, then please feel free to email me. If there was some participants online today, then obviously we would have gone on longer, because I could have asked you questions, you could have asked me questions, just to see that the learning had taken place and you understand this. But the recording will be uploaded onto Moodle, and also you have this as a template to go through. I hope that I've given you some good examples that you can apply and address the learning outcomes. I'd just like to mention that with your readings, use academic readings such as your books, your journal, articles, support what you're saying. So if you're talking about legislation, find some readings that back up what you're saying. Make it an academic source, or put your references in there. If you have any questions, then please email myself, Caroline at ukuniversity.co.uk. Thank you.